Now by Dr. Todd Ellerin, who's the Director of Infectious Diseases at South Shore Hospital. Doc, great to have you with us as always. The latest reports from the state show that the rate of positive cases and hospitalizations are declining a bit. At the very least, they're staying steady and maybe declining a bit. But we have seen big jumps in deaths. Is that what you might expect right now if the situation is stabilizing?
That's right, Ed. Even as cases stabilize and as we're seeing hospitalizations stabilize, remember, deaths tend to lag behind this at least a couple of weeks. When patients get COVID-19, the ones who do poorly, often it's not till a couple of weeks after they're diagnosed.
Doctor, there's new information for people in Massachusetts who may have undergone the antibody testing, and it actually has to do with their results. Tell us about that. I know there are a lot of people who have done that, and they want to know this information.
This is really important, Maria. I want to focus on the positive result. Those people that have tested positive, what we generally say is they have had the COVID-19 infection in the past. But there is a chance that they could still have active infection. So the Department of Public Health right now has basically said if you test positive, you need to stay isolated at home for 10 days. Now that may change as they get guidance from the CDC, but this is very troubling. Therefore, you need to know the potential consequences before you accept that test.
And I just want to say really quickly, I know some people who are testing positive, and then they're testing positive again, and then they're taking another test and testing positive again.
That's right, but Maria, remember, we're talking about the blood test with the antibody test. There's also that swab test that you can test positive repeatedly as well.
Good. Thanks for clearing that up.
So let's talk about where you are. What's the situation right now at South Shore Health with COVID-19, hospitalizations, and importantly supplies? Because we've talked about that from the beginning.
Okay, so we talked about space, supplies, and staff as being the three S's. So, there's still issues with supplies. Every system has a different issue. Our issue right now is gowns. So we're really looking for a need for gowns.
Yeah.
Interesting.
Yeah.
Let's talk about elective procedures. They're expected to resume in one of the early phases of reopening the state. Anything that the hospitals that could further delay that starting time again?
Well, first, what I want to say about elective procedures is remember what was elective 2 months ago may not be elective if you're the person that's sitting with an early breast cancer, right? It may not be emergent, but that's certainly urgent for that person. So now that we're 2 months forward, we really have to think about trying to open this up in as safe a way as possible. Obviously, we need the governor's backing and his team, but remember, we also need to make sure certain surgeries require intensive care units for that early post-operative stay. So we have to make sure we decompress the ICUs from COVID.
Dr. Ellerin, thank you so much
for
bringing your information. Great to see you. Be well, sir.
Be well.
It's great to see you.
Thank you.